Welcome to Behavioral Health in the New Normal, a podcast developed by Prestige Community Resources, aimed at bringing healing back to our community through knowledge, expert advice, and positive messaging. The show is a joint venture between the Department of Behavioral Health and Prestige Community Resources, funded by SAMHSA in response to the challenges currently impacting our communities. Hosted by Paul Wells Sr., who uses over 30 years of extensive clinical social work experience to conduct insightful interviews with experts and professionals on a wide range of topics that impact the Washington, D.C. community. From behavioral health crisis to education to financial hardship and anything in between. This show will provide information and insights that will surely make a difference in your life.
Hello, and welcome back to Behavioral Health in the New Normal. I am here with Lweyni Nkonko. Lweyni, can you tell us a little bit about yourself and your background?
All right. I am a clinical social worker by trade. Currently, I am a clinical manager at Prestige Healthcare Resources in the District of Columbia. I went to Howard University for grad school. I also went to the University of KwaZulu-Natal for grad school as well. Mental health for me is a very personal matter. I'm also a consumer, so I'm not just a mental health professional. I'm also a consumer. I am about 15 years in recovery, and it has been an interesting journey. And I know that having access to mental health resources, psychiatrists, therapists, case managers, having access to all that has made a great impact on my quality of life. And it is my sincere hope and mission as a mental health professional to make sure that those of us who are affected by mental illness, like myself, have access to that so that they are also able to pursue their dreams, aspirations, and live fulfilling, powerful, enriching life.
Okay. And you said that you are a consumer of services in your journey. Can you give us a little, if what you're comfortable with sharing, can you give us a little bit more about your journey and your experience with mental health?
Sure. I started having symptoms probably when I was about 27 or 28. And it really, I didn't know what was going on. It's funny because I took psychology in school, but when you're sick, you don't know what's going on. And I started having symptoms and nobody knew what was going on. And, it was a progression. At first, I could still manage. I could still hold the job and I could still function. But eventually, at some point, it really, really got bad. And I could not perform. People were saying, we can't hear you speak. Well, what do you mean? I'm talking. And, I was not coherent. So it literally progressed to the point where I went off a cliff. And my employer back then thought that I was on drugs, and they offered to give me up. I said, no, I'm not on drugs. So I lost my job and I was terminated because I was mentally ill, but everyone said that I was on drugs and didn't want the help. And then after that, I was sick for a while, and it took my people a while to figure what was wrong. My immediate family was not around me. They had already left South Africa. And so some of my friends picked up, but of course I was in denial. I didn't think anything was wrong. And, I had a lot of connections, support from my family, even though they were far away. My dad would call his friends and they would come in, yeah, come on over. You can start on Monday. The offer letter will be ready for you. All you got to do is sign it. And I would show up. I was paranoid. I thought everyone were out to get me. I thought my own family was out to get me, and this went on for a while. And then my landlord where I was staying, we connected on some level. And, he was a pastor and he helped me out. And shortly thereafter, I was diagnosed. And after I was diagnosed, night and day, the medication that I took worked for me like a charm, no side effects. I've been on it for 15 years and it's still medication I take. Normally with psychotropic medications, you got to take other medication to counteract the side effects like the tremors or the involuntary almost body movements, and I don't have any of that. So that was the first time that I had a psychiatric evaluation when I was diagnosed. And then I was okay for about 5 years and or 3 years, I think. And my doctor took me off of medication because he thought he had misdiagnosed me with paranoid schizophrenia. I thought, well, you know, maybe it was something else because you're responding to medication and you're functioning right. And he took me off the medication, and that's when the real crazy started. You know, and I'm not sensitive to the word crazy. You know, I mean, I don't think it is a personal slight when that word is used around me. So that's when the real crazy started. I did okay without my medication for about 10 months, but by the 10 months, it was lights out. You know, I packed my bags. I left my parents. You know, by the time I was in the US, I left my parents because they were allowed to get me. I left school. I packed my bags, got on a one-way ticket. I went to South Africa, and I withdrew all the money that I had. And I didn't have much, you know, as a student, didn't have much, but I withdrew all of it. I was walking around with cash on me about worth of rent in South African rand, you know, not dollar. And I was walking with it on me, not realizing that's dangerous. So when I got there, I went back to my landlord, the one who helped me out the first time that I was diagnosed, and he let me stay for about a couple of days. And told me, you know what, I need the money, and I have a tenant who's ready to move in, so you know you're gonna have to leave. And I just could not connect the dots. That's how seriously ill I was. I couldn't connect the dots.
So how did you said you were that seriously ill, and so how did everything get back on track for you? Like,
everything got back on track. I ended up being homeless, and while being homeless for, I think I was homeless for about a week or 2 weeks. I can't recall because I didn't have a calendar on me or anything like that. Literally living on the streets. And one day I was about to walk up and down the highway, and people started calling the police. You know, there's somebody walking up and down the highway, and the police officer obviously had been trained in mental health. Took one look at me that I was having a nervous breakdown. He took me to a hospital where I was FT12, and I stayed there. The medication they gave me isn't one I normally take, so it took a while for it to get came for about 3 months. I didn't know where I was or who I was or what I was doing. But once it kicked in, I texted my sister using one of the other residents' cell phone. She called me. My dad called about a minute afterwards, and about a week afterwards, my parents did everything. They sorted my passport, and U.S. Embassy was really supportive. Normally, you got to go for an interview for these to get a visa, but they were very supportive, and everything was organized. And within about a week, I was back in Maryland with my parents. I literally came back with nothing but the clothes in my back.
That is literally an incredible story. That is incredible. And I can understand why you relate to consumers and are able to help them in the manner that you are. So that is an incredible story, and you should be so proud of yourself. I guess a question that I would have, just knowing all of that, you now work as a mental health provider. And that's and that can be stressful at times. And you're also a consumer of services. So how have you been taking care of yourself in the pandemic? Because the pandemic is a stressor all on its own.
So for me, I do a lot of things, but if I had to just narrow it to 3, I have to say my faith, my people, and exercise. You know, that's my recovery plan. You know, so when I say, you know, well, when I say exercise, I should rephrase that science, you know, so my faith, science, and last but not least, my people. So, you know, Jesus is my, I mean, I know some may say that's not scientific, but and also science, by science, I'm referring to my medication, exercise, sleeping 6 to 8 hours, not doing drugs, no alcohol, and for my people having that support system, you know, they know, you know, they keep an eye on me. I mean, my dad has a key to my apartment. He randomly comes in to make sure I'm taking my medication. I mean, I take it, you know, but he does that. He will do that. He'll randomly pop by, and he knows where I keep it. He'll look in there, and I have it in a tray, you know, for every single day of the week, and he looks at it. So a support system is critical for anybody experiencing mental illness. Without it, it is tough sledding.
So basically, we all know that mental health is very important, especially for frontline workers. So how would you, because we want to teach people how to practice positive or good self-care. So what would be some tips that you would give individuals to kind of do that? Say I don't know anything about self-care. I don't know any of the terms, any of the terminology. What are some tips you would give individuals to kind of just take care of themselves? Because we often forget, as frontline workers, we often forget to take care of ourselves in the process.
I agree with that. And I think the first thing is carving out time for yourself. Just like you would if you made an appointment with your doctor for a physical or your OBGYN, you wouldn't miss it. So you make an appointment with yourself, whether you're a morning person, a night person, or somewhere between. So you make an appointment with yourself, whereby, whether it's for 10 or 15 minutes or an hour, however long it is you have on your calendar that you cannot miss. And you let your people know that this is my time. No phone calls, no nothing, I'm doing me. And self-care means different things to different people. Some people may not experience exercise or working out as self-care. So once you figure out what self-care is to you, what is that makes you feel relaxed? What is that makes you feel your best? What is it when you do you feel, yes, this is living? So whatever that is, carve time out, make time for it. For me, it's definitely exercise. For me, it's meditating, spending time, reading scriptures, praying. For me, it's spending time with my family. Obviously, it's different with COVID. We have to do things socially distant and virtual. But bring time for yourself and figure out for yourself what is it that makes you feel relaxed and makes you feel happy, makes you feel like, yes, I'm taking care of myself. It could be reading a book, it could be hiking, it could be journaling, whatever it is. It's different things to different people.
Mm-hmm. So, and I guess a follow-up question would be to those of who are frontline workers, their support system. What are some just suggestions that you would give to our support system to kind of just help frontline workers make it through the pandemic and feel supported through the pandemic?
For the family and the people, I would say just being there. Just because somebody gets up in the morning every single day and goes to what is essentially a war zone, except it's just dead bodies and sick people all around, doesn't mean that he or she's okay. Check in. Like, how are you doing? And actually listen. Let him or her vent. If he or she needs a shoulder to cry on, it might have to be virtual or socially distant shoulder to cry on, or her, have that shoulder to cry on. Just listening and being there, and also caring for them. If you have somebody in your family who is a frontline worker, might mean cooking for him or her. It might mean watching his or her kids. It might mean saying, listen, I know you got 20 million things. Let me help you out with cleaning your place, or I'm gonna pay somebody to come and clean your place for you. Whatever that is, and find out what do they need. Ask them. I know you're stressed. I know you're under a lot. What can I do to help you lessen the load? What can I do to make you feel less stressed? And do that.
Okay. That makes a lot of sense. I think as people, sometimes we want to offer support to people, but we don't necessarily know how to do that or know what kind of support they need. So for you to just say, yeah, just be there for them, I think that's a helpful tip that we can all use. So in the pandemic, I guess, just what are some things that that you found helpful? If we break down a day, what does a day look like for you? And what are some things that you found helpful to kind of make it through? Because a lot of the things that we used to do, we can't physically go to therapy, but we can do telehealth, yes, but we can't physically go to therapy. We can't because one of my stress relievers is I shop, so I can't really go to the stores like I used to anymore. So what would a day look like for you? And
so it depends. If it's Monday through Friday, the days are the same, whether it's Monday through Sunday, but Monday through Friday, I work, so my day starts a little bit earlier than usual. Whereas on Saturday and Sunday, my day starts around 6 or 7. Usually by 6, I'm up. But during the weekday, I'm up by 4 o'clock. I like to work out first because I feel like I need to be wide awake before I start to pray and meditate. and getting out of bed, I might not be fully awake yet. So I don't want to try to meditate or pray half asleep. I'm sure God still hears, whether you're sleeping, but I like to be present. So I start my day with a workout, and after I work out, I will meditate and read scriptures. And after I do that, I will get myself ready. And while I'm getting myself ready, I have Christian rock music in the background playing, get my mind right for the day. Then I will have breakfast. That's the last thing that I do. I usually have breakfast, and then by about 6:15, 6:30, I'm leaving, heading off to work. And and then I get to work around 7:15, and my day starts.
Okay.
And it's around the weekend, I'm sleeping a little bit. So, but by 6, I'm up. Of course, I again start with working out and reading scriptures and praying. But of course, I have other things I gotta do, like cooking and running errands or hanging out with friends. Some of it usually is virtual because of the pandemic. But so it's different.
Yeah. And so for someone who may be feeling burnt out, who may be feeling stressed out, if you basically have any words of encouragement to kind of help them make that through that, and how can they realize some of the signs? How can a person realize some of the signs of just being burnt out?
Being burnt out, I think we have to, I like to approach it from two different ways. Somebody can be burnt out because they're in the wrong field, they're doing the wrong thing, and they're not passionate, they're not into it. But somebody can also be burnt out with something that they love. But in that case, I wouldn't recall to it being burnt out. I would just refer to it as, fatigue, overwhelming, stressful, overwhelmed, overstressed, like what's going with the, medical professionals who are treating COVID patients, surrounded by death. They all love what they do, but it's overwhelming and stressful. So, if somebody is burnt out because he or she, hates what he or she is doing, then, he or she needs to do something about that, Get tools, get the knowledge to figure out what he or she wants to do and follow that passion. But if somebody's feeling, stressed out or burnt out because they're feeling overwhelmed, they love what they do, but they're feeling overwhelmed, then it might be important to find a way to step away. And obviously, we can't afford to be without our medical professionals. That might mean, on the weekend, carving out, on your time off and you have to be at work, carving out half a day or a day whereby you're totally plugged out, So, and it means different things for different people. So if somebody feels that for them to recharge, he or she needs to be by him or herself out in the woods, then that's what he or she will do to recharge and to replenish. But if somebody feels that he or she to recharge, to replenish, he or she needs to spend the whole day playing, with his or her kids or spending time with his or her girlfriend, or boyfriend, then that's what she'll do. So figure out what is that I need to do to feel recharged and rejuvenated, and then make a day of it, or as much time as your schedule allows. The more, the better.
If I end every podcast this way. So if you could give 3 tips for frontline workers to practice better self-care, what would those 3 tips be?
Before I answer that, can I just quickly please apologize to my landlord? I actually assaulted him in the midst of my nervous breakdown.
Yes, you can. Please do.
I did. Alan, if you're listening, I am sorry. He actually pressed charges, but they were dropped. And I think I spent like one or 2 nights, in jail, but he dropped the charge. And I was, without him, without anybody. So he dropped the charges, but I'm sorry, Alan. I wasn't myself. It was the mental illness. Okay. All right. So to answer your question, the 3 tips that I would give, I think it's important, and I don't think this just applies to the pandemic. I believe this applies to life in general. To find meaning and true purpose, it's important to serve a cause bigger than oneself. And that could be whatever it is that is for the person. Whether it's faith, whether it's the planet, whether it's his or her family, whether it's, the environment, whatever it is. But, you have to have your reason for getting up in the morning. Why do you get up in the morning? You know, I can't just because I want to make more money or because I have bills to pay. That's not sustainable. So you have to, you know, serve a cause bigger than yourself and find out what that is for you. And the second one, I would have to say exercise. I know not everyone likes to exercise, but it does so much for you. Besides the physical benefits of keeping, you know, a lot of physical conditions out of the way, you know, you feel different. You know, it has a positive impact on mental health. And it doesn't have to be anything rigorous. You know, it could be going for a 15-minute walk, walking your dog. That's exercise. You don't even think about it. Or, you know, playing around the yard with your kids, whereby, you know, you guys are throwing frisbee and chasing after whatever it is. Just even 15 minutes. If you really don't like that, then spending 15 minutes in a sauna has the same impact on your mental health and physical health. And last but not least, relationships. We all need to be connected, you know, connected to our families, connected to our friends, connected to our co-workers, connected to our neighbors. And of course, you're not going to be best friends with everyone, but it's important for, you know, relationships. I mean, we're social creatures. We're made to socialize. So if somebody is trying to survive, yes, the pandemic has made that difficult because we're all, you know, socially distancing, but we can still connect virtually. It's not the same. It's not a substitute for face-to-face interaction, but it's better than nothing. Whether it's a phone call, a video chat, whatever it is, we all need to be connected to one another.
Mm-hmm. So, Lweyni, I want to thank you for coming in today and talking to me. I think you gave some very helpful hints for frontline, or helpful tips for frontline workers. And thank you for taking your time to share your experience and your knowledge with us today.
Thank you, today. It was my pleasure.
All right. And we'll see everyone later. Thank you. Bye.
Bye-bye.